Okay, if I could ask those leaving the public gallery to do so as quickly and as quietly as possible as we resume business. And the next item of business is a members' business debate on motion 15411, the name of Paul Sweeney, on publication of the Marie Curie report, Dying in Poverty in Scotland 2024. The debate will be concluded without any questions being put. I'd invite members wishing to participate to press the request to speak buttons and invite Mr Sweeney to open the debate. Around 7 minutes, please.
Thank you, Deputy Presiding Officer, and I'd just like to extend my sincere thanks to colleagues across the Parliament who supported this motion for members' business and therefore helped to secure valuable parliamentary time for us to consider this crucial new piece of research by Marie Curie, the Dying in Poverty in Scotland 2024 report, which is based on research carried out by Marie Curie and Loughborough University, looking at the extent of end-of-life poverty in Scotland. The report laid bare the prevalence of deaths in poverty in Scotland, with 10,400 people dying in poverty, equating to 1 in 4 working-age people and 1 in 6 pensioners, with working-age people with dependent children most at risk of end-of-life poverty. This Parliament often discusses the plight of health inequalities, and rightly so. But progress in reducing the disparity in outcomes across health and social care is stagnant, and sadly this report further highlights that reality on multiple fronts. Indeed, more working-age people of a minoritised ethnicity die in poverty in their last year of life, including 47% of black people compared to 25% of white people, and women overall are more likely to die in poverty than men. Debate in recent weeks around assisted dying has often referenced the notion of dignity in dying, but, Deputy Presiding Officer, I think we can all agree, looking at this report and the stark figures I have just mentioned, that a dignified death is not a guarantee for many people approaching the end of their lives. Members may be familiar with earlier work by Marie Curie and the University of Glasgow in the Dying in the Margins exhibition, which was shown here in the Parliament last year, and it documented the impact of poverty on the end-of-life experience of people with a terminal illness. The research in that exhibition captured the reality of the home environment and the barriers that participants experienced as they approached the end of their lives whilst in poverty. One example which has stayed with me is that of a patient who lived in a housing association home which no longer met their accessibility needs as they got more poorly and infirm. But due to the tenant approaching the end of his life, the housing association was not willing to make the investment necessary to do the adjustments to make the house more suitable and comfortable. That meant that the gentleman couldn't die as he wanted in his own home, surrounded by a familiar setting, and he ended his life in hospital. I think that's something any of us who had a loved one in that situation would be deeply distressed by. It's simply not good enough. Deputy Presiding Officer, it is important that people at the end of their lives have agency, choice and control. What the Dying in the Margins exhibition and findings reported in 2023 and what the Dying in Poverty Scotland report of this year has found is that this is not the reality for too many people in Scotland. They do not have that agency, choice and control. The report therefore recommends that the Scottish Government consider specific support for terminally ill people with dependent children under 16, as well as support for all terminally ill people with energy costs. So I would be grateful if the Minister could set out in her remarks what assessment the Government has made of this report and what steps it will take to realise these recommendations, noting the Consumer Scotland report published last week, which also recommended targeted financial support for those who are terminally ill. Deputy Presiding Officer, I have now proudly brought 2 debates to this Parliament relating to the work of Marie Curie, and that is for 2 reasons. Firstly, I have been familiar with their exceptional work from a young age, since helping to fundraise for the new hospice in the grounds of Stobhill Hospital, whilst I was a pupil at nearby Turnbull High School more than 17 years ago. And secondly, I was fortunate to visit the new hospice at Stobhill last year and met with a number of constituents who were nearing the end of their lives, and certainly their experiences and stories have had a lasting impact on me. I want to finish by referencing one patient who comes to mind, whose story I've shared before with Parliament. She lived in a deprived area of Glasgow in Bridgeton, She was only in her early 40s, but approached her GP multiple times to complain of pain with what she thought was tonsillitis, but was dismissed and sent home with painkillers on repeated occasions. She came from a difficult upbringing. She'd had a fairly chaotic lifestyle, but felt that she was getting her life back on track, and then was struck down by this chronic condition that she was struggling to get support with. But by the time she was finally listened to, referred and diagnosed with a cancerous neck cancer, it was too late to treat, and it was terminal. She was speaking to me through a tube in her throat in the final stages of her life, and relayed to me her distress at being robbed of her future. She had 2 young children, and it was a very difficult conversation to have with a young mother in that situation, having overcome so much adversity, that she was then robbed of her life in what she felt was a turning point. And I think sometimes when we talk about the Glasgow effect and poverty and inequality, it sometimes just hits you really starkly. And that was certainly a very moving experience for me.
Would the member take it?
Happy to give way, yeah.
Martin Whitfield.
I'm very grateful to Paul Sweeney for taking an intervention, and he's made a very, very powerful contribution on a massively important issue. And isn't it right that a society should reflect upon itself how it cares for the very start of life with babies and children, but also at the end of life? And in the member's contribution, he's adequately shown that we're not addressing that sufficiently and in the right way at this time and in this place.
Paul Sweeney.
I thank my friend for making that intervention, and a great observation it was. I think what struck me with that experience of discussion with that lady who sadly passed away just the day after I visited, is that at the very early stages of someone's life, they are doomed in many ways to an early death, a premature death, and that is the nature of inequality in Scotland today. Those social determinants of health at the very early stages of infancy, childhood, are so critical, and that is what we really need to understand if we are to truly solve these ingrained issues of inequality in our society. I'm happy to give way to my colleague.
Monica Lennon.
To my colleague Paul Sweeney and for securing this really important debate, and to pay tribute to him for all his support for Marie Curie. Recently, I know other colleagues have had many emails. 2,500 people in central Scotland have emailed me standing up for hospice care. Does he share their fear and mine that if the Scottish Government doesn't do more to fund and support our amazing hospices, that it will be the poorest people in Scotland who suffer the most?
Paul Sweeney.
I completely agree with my colleague. Often the reason we underestimate this is because the dead have no agency, and people in the final stages of their life are just dealing with the immediate trauma and effects of that. And the reflection and capacity to advocate is limited. So I think Monica Lennon makes a very important point in that respect, and that's why these reports are so critical. It's also critical that we get hospice care right. I certainly know that in the case of the Prince and Princess of Wales Hospice, when I visited, a third of their beds were unusable because of a lack of nursing staff due to the differentials in National Health Service pay rates. Yes, happy to give way if I have time.
I commend Mr Sweeney on his excellent speech and agree with the points he makes. Does he agree with me that we could really organise the NHS much better, and it could support Marie Curie, Macmillan nurses and hospices much more effectively, much more practically, at much less expense, and far quicker for those who require end-of-life care? And that can be done without necessarily increasing the overall amount of money provided, but just getting the public sector to work more effectively with these marvellous charitable institutions in Scotland.
Paul Sweeney, and if you could begin winding up, please.
I completely agree with Mr Ewing's observation, and I think it is absolutely critical that, given it's a universal truth that we all face the end of our lives at some point, and most of us will rely on palliative care or hospice care of some kind. Therefore, it is important that we better integrate that, and the essence of what was aspired to in the National Care Service should consider how we better do that, and that we would then release capacity in the acute hospitals in doing so, and thus create a virtuous cycle of efficient healthcare expenditure. So the report rightly references the practical financial difficulties faced by terminally ill people in poverty, but as evidenced by my constituent, who I spoke about, often this group of people regrettably have less agency, having to advocate more and push harder for answers than their less deprived counterparts. So, for my constituent and others in Scotland like her, I move the motion in my name. Thank you.
Thank you, Mr Sweeney. We move to the open debate. There's quite a bit of interest. I'm intending to get everybody in, but I'm conscious that we also begin afternoon business at 2 p.m, so we'll need to leave enough time for the Chamber to be prepared for that. I call first Eleanor Whittam, to be followed by Liz Smith. Up to 4 minutes. Ms Whittam.
Thank you, Presiding Officer, and I thank Paul Sweeney for bringing this hugely important report to the attention of the Chamber. And can I also extend my sincere thanks to Marie Curie and Loughborough University for researching this urgent issue and bringing the reality faced by those dying in poverty to our attention. And can I also commend him for the way that he narrated the experiences of his constituent. I think none of us can be failed to be touched by what he put out to us. We rightly spend a lot of our energy and resources in this place combating the scourge of child poverty, doing all that we can to ensure that from the very beginning of life, this nation nurtures our youngest. And despite all of the challenges, we are making good progress in that regard. But, Presiding Officer, what we don't talk enough about in this place, in our communities, in our homes, is about dying. As a nation, we find it too difficult, too awkward, too upsetting to speak to each other about the reality of death, dying and terminal illness. And what we don't think about enough in this place when we are creating policies and strategies surrounding the eradication of poverty is how poverty manifests itself for those who have a terminal illness and for their families. No one who is dealing with a terminal prognosis should be worrying about making sure that they are warm enough, that they can run any specialist equipment they rely on, that they can have enough money to ensure that they can get the nutrition that they need to be as well as they can be. Dying from a terminal illness is always going to be the most difficult thing that we face as human beings, and Paul Sweeney outlined how that affected that young mum. It's an existential crisis. But as a nation, we cannot thaw the reality faced by too many who simply do not have enough to live their last moments in comfort, but instead live in cold surroundings with mounting debt and an ever-increasing worry about what they are leaving behind for their loved ones. That anxiety alone is a heavy burden to bear. In East Ayrshire, which forms part of my Carrick, Cumnock and Doon Valley constituency, 28% of people with a terminal illness died in end-of-life poverty. And 23% died in fuel poverty. And far too many of my constituents who live rurally, they face the most horrendous fuel poverty when dying if they are reliant on an oil heating system. And we also know, and we also know that rates of fuel poverty and dying are also higher for those in older socially rented homes. I'll give way to Finlay Carson.
Briefly, Finlay Carson.
I appreciate the member giving way, but we also reflect on the comments we heard about the lack of budget for aids and adaptation, where a housing association in my area needed $3 million but only got $700,000. And whilst there's an increase in the budget this year, it still falls way short of what's needed. So do you share my disappointment in the government now actually stepping up to the mark and delivering the funds that are needed?
Through the Chair, Eleanor Whittam.
I do recognise the issue that Finlay Carson has put to me. I have made representations to the government on this on several occasions, back and forward to my Health and Social Care Partnership and Registered Social Landlord. So I absolutely get the point that he raises, and it's something that I will continue to challenge. What we also have to recognise is that Paul Sweeney set out that 10,400 people die in poverty in Scotland, and that's an increase of 27% from 2019. And as we've heard, for those who are working age, this is even higher, in 1 in 4. And 1 in 5 people die in fuel poverty in their last year in Scotland. The report also identified particular groups at risk of dying in poverty, including working-age parents with dependent children, women and people from minoritised backgrounds. This is why collecting and collating disaggregated data is essential in understanding the issues across groups. And as Paul Sweeney outlined, 25% of those from a white ethnicity die in poverty when facing a terminal illness, but a staggering 47% from a black minority background with a terminal illness die in poverty. We need to understand all the drivers behind this so we can make coherent policy. There are steps that the Scottish Government can take that will make an impact, and I ask the Minister to reflect on these. Extend the eligibility for the Scottish Child Payment to parents living with a terminal illness with dependent children under 16 on presentation of a BASRIS form confirming that they are eligible under the special rules in terminal illness situations. Provide extra financial support for terminally ill people with their energy bills. This could include extending eligibility of the winter heating payment to all terminally ill people and a reinvestment in the Fuel Insecurity Fund. and bring a minimum income guarantee forward and work even harder towards eradicating the gender pay gap, that has an impact on women who are dying in poverty. We also urgently need a social tariff for energy to prevent fuel poverty at the end of life, and I urge both the UK Government and the Scottish Government to make this a reality. And finally, I also support the calls for the UK Government to unlock pensions for those close to pension age who have a terminal diagnosis. And for those who have not paid enough national insurance contributions at that point, please ensure that they have a pension level payment. That, Presiding Officer, feels like the right thing to do. Thank you.
Thank you. And I call Liz Smith to be followed by Carol Mochan. Up to 4 minutes, Ms.
Thank you. Can I say well done to Paul Sweeney, not only for getting this debate to Parliament, but for the speech that he delivered, because I thought it was very moving. He's quite right. This is a crucial piece of research, and it is incumbent upon all of us, just as Eleanor Whittam has rightly spelt out, to take notice of it. And I think it's particularly important and topical at this moment, given the fact that the assisted dying debates, which are ongoing both north and south of the border, have raised critical issues, not just about that particular ethical decision that we have to make, but about how compassionate our palliative care actually is. And for that alone, I think these debates, I find them incredibly interesting, apart from anything else, but I think they're extremely important because they do raise this whole issue of palliative care. And I'm glad from what we've heard in recent weeks that I think there is cross-party agreement about just how significant this debate actually is, because there's clear acknowledgement that the report's findings paint really a very disturbing picture into the lack of support available to some of the most disadvantaged in our society in their final moments of terminal illness. The scale of the numbers are stark. In Mid-Scotland and Fife regions, around 1 in 5 people died in end-of-life poverty, and that's a matter of concern to us all, such as the very large proportion of people who are not receiving their support. And can I pay tribute to Fergus Ewing, who I thought raised a very important point about how better we might be able to address that. Now, the report goes into very considerable detail, forensic actually, about the wide variations between the different demographics, with those whose circumstances, with a single parent, working age, the number as high as 4 in 10 dying in end-of-life poverty. And as we're all aware, palliative care is predominantly administered by the charitable sector, and at this point I want to pay tribute to the work of the charities in Marie Curie. Yes, in just a minute, I just want to extend my congratulations to the work of Marie Curie, as well as Cancer Card, which provides such a comprehensive service and which is so admired by the public to so many people to give them peace of mind at the end of their life. Mr Ewing.
Fergus Ewing.
Yes, I thoroughly endorse what Liz Smith has said, Presiding Officer, and appreciate the way that she said it. This is one of the pressing problems in Scotland right now. And is she aware that in Raigmore, in Highland Acute Hospital, beds, 1 in 3 are believed to be occupied by people at the end of the life? Highland Hospice believe that at least 40% of those could receive better care where they wish to be cared for in their own homes, in the community, and that, frankly, Raigmore, which provides excellent service to those who need fixed, is in danger of becoming a care home rather than an acute hospital.
Liz Smith.
I was aware of this statistic, but because Mr Ewing raised that very issue earlier this week when I was in the chamber when he said that, and I was taken aback by that statistic because it's very serious, and it is one that should make us think very carefully about what the way forward is, because, as Mr Ewing has rightly pointing out, we can't have that circumstance because hospitals have got to get on with so many other things. We've got to address the issue from being able to ensure that people who are at their end of their life get, quite frankly, better care than is just possible in hospitals. Not taking anything away from that care in hospitals, but I think we can do things better. Now, the Finance Committee, on which I sit, has been looking very closely indeed at the economic consequences of Scotland's ageing population. But I think this particular report sends out the challenges when it comes to the effects from society. And I want to pay tribute to my colleague on my right here, Miles Briggs, whose private member's bill I think is trying to address an awful lot of the questions that have been flagged up by Mr Sweeney, because it's essential that we do something about that. So I give full support to Miles Briggs. We have to do this better, Deputy Presiding Officer. I'm sure you of all people are very aware of and conscious of this, having brought forward the bill, your member's bill on assisted dying. So thank you to Paul Sweeney, and thank you, Deputy Presiding Officer. I mean, I always agree on some of the aspects of the debate, but I think you've done a wonderful job to bring that to Parliament.
Thank you very much, Ms Smith. And with that, I call Carol Mochan to be followed by Bob Doris. Up to 4 minutes. Ms Mochan.
Thank you, Presiding Officer. And can I also thank my party colleague Paul Sweeney for bringing this important debate to the Chamber. And can I also thank everyone at Marie Curie and their partners for producing this vital report. Everyone deserves as pain-free and peaceful a death as possible, surrounded by those that love them, in a place that comforts them, and the choice is theirs. Like so many things across the course of our life, the process of death is influenced by the poverty and inequality experienced by so many. It is the root of the injustice that permeates our society, and that injustice can sustain from the cradle to the grave for so many. I simply cannot accept that, and this is really what has driven me to speak in today's debate and other debates in this area. We have to do more to stop so many having so little, whilst the few have so much. At a time when the inequalities surrounding death are so prominent in our national debate, there has never been a better time for this report, or indeed this debate. At every stage of a person's life, including death, poverty is an anchor on their ability to live as others would. I have met constituents who spend a great deal of their final years of life worrying about how they can afford to leave their families behind, or even if they can afford the care required to sustain a moderate quality of life up until the end. The truth in our society is some are worried about avoiding tax on their second homes that they wish to pass on to their children, while others are worrying about whether they can actually even afford the cost of a funeral. That isn't a just or a fair society. In my home area of East Ayrshire, 17% of people died in poverty in 2023, and 23% were in fuel poverty, according to this report. The figures across my region of South of Scotland vary, but they are not drastically different. That's nearly 1 in 5 people struggling to heat their homes or put food on their table, people who are often aware that they are sadly soon to pass. Can you imagine the mental and physical strain that kind of pressure puts on a person and puts on their family? I think that we can all agree that nothing can be worse. We have heard in the debate today simple things like needing to make a household adaptation can become a luxury for some, a luxury when they are unsure if they can even afford to feed their own family. This is simply unacceptable. So let me be clear, it is my belief that we need not have an economy that works only for the rich, but rather ensures everyone in society has the means to live and die in dignity. In 2024, we live in one of the richest countries in the world, yet there are many among us who experience constant poverty, from the cradle to the grave. This is all that they have ever known or will ever know, and that is a truth that we all have to accept in this chamber. This is as unacceptable today as it was many decades ago, when the welfare state was transformed by serious government intervention. To my mind, we will require a similar revolution in practice and in thinking to address the problems I and many others here in the chamber have highlighted today. I call on everyone to think of that, and I call on the Scottish Government to respond to the points raised by my colleague Paul Sweeney and by others in the Chamber. And let us look to make sure that we can eradicate poverty in this country, which, as I have stated, is one of the richest countries in the world. Thank you, Presiding Officer.
Thank you, Ms Mochan. I now call Bob Doris to be followed by Rhoda Grant. Up to 4 minutes. Mr Doris. Sorry, Mr Doris, your microphone doesn't appear to be working. Could we have Mr Doris's microphone? Let me start again. I'm afraid we're still not hearing you. I'm going to go to Rhoda Grant first, and we'll try and sort out the issue and come back to you, Mr Doris. Rhoda Grant, up to 4 minutes.
Thank you, Presiding Officer. Can I also add my thanks to Paul Sweeney for securing this debate on palliative care, and also commend Marie Curie for their Dying in Poverty in Scotland 2024 report, which shines a light on the very difficult situation many people find themselves in at the end of life. People facing terminal illness often lose their income and move on to benefits, and that can be difficult to do when facing end of life, more so if English is not your first language. There are many excellent support services out there that do help people, Marie Curie themselves, Macmillan and the like, and there are also other small local charities that provide support. One example of that is Western Isles Cancer Care Initiative. Wiki advocates for people with cancer, but this is more important for those with a terminal diagnosis, helping them access support and also providing small grants. However, not everyone is lucky enough to be able to access such excellent services. For people living in the Highlands and Islands, fuel poverty is also an issue. People are unwell, they need to be warm, but if there's concerns about the cost of heating, that simply adds to the stress. And we can only imagine the stress of dying. We will all face it, but it is difficult to imagine. And I'm sure we've all faced the stress of losing someone close to us and worrying about their well-being, trying to make sure that their last precious days are comfortable, free from worry, and allow them to live them well. If financial constraints are stopping family from ensuring a good death, then that adds to their distress and how they will deal with grief going forward. Hospices are crying out for funding, and hospice at home is desperately needed. Most people want to die at home, yet 70% of us will end up in hospital towards the end of our lives, and many of those who go to hospital will die there due to a lack of hospital care in the community. And they make up much of the delayed discharge figures, as we've heard. In Highland, £45 million is spent yearly on end-of-life care in hospital, while only just over £11 million is spent on end-of-life care elsewhere. I support Miles Briggs' membership bill to improve end-of-life care in Scotland.
Paul Sweeney.
I thank my friend for giving way. She's made a powerful point about the numbers of people at the end of their lives dying in hospital. And I think that's particularly egregious in rural settings. Recently had the opportunity to visit with the Health Committee to Skye, and it was expressed by a number of people there, their fear of ending their lives hundreds of miles potentially away from their home, far removed from their friends and family, and the stress that might place on their relatives trying to visit them in the final days and so on. So perhaps my friend recognised that it's a particularly egregious problem further afield in rural and remote settings to the Central Belt.
Rhoda Grant.
Yes, indeed, and that is a common situation in the Highlands and Islands, and very difficult for family wanting to spend time with loved ones. Highland Hospice knows that and is leading the charge in Highland. They've formed partnerships with services and the third sector. They've delivered a 24/7 helpline for people with palliative end-of-life care needs. And this alone has saved NHS Highland £2.3 million, while providing support for 415 people in just 6 months. Kenny Steele, CEO of the Highland Hospice, says, delivering better planned and coordinated care towards the end of life will result in less unscheduled care in hospital and deliver better value and high quality care. Presiding Officer, we need the statutory services on board to make sure this model works. It saves money, but most importantly, it allows family to enrich the final days of their loved ones, living their lives to the end. When days are few, life is precious. And I'll give way.
Very briefly, Fergus Ewing.
Yes, having met Kenny Steele recently, does Rhoda Grant agree with me that whilst they work with all other hospices throughout the country, their funding from the government amounts to only 25%, 2 million of their 8 million running costs, whereas many other hospices are fully funded?
Rhoda Grant, if you've been including.
Yes, indeed, and that's a huge problem for Highland Hospice, but I would commend their fundraising effort in the communities that support them. It shouldn't be that way, and hopefully it won't be in the future if statutory services come and help them. Presiding Officer, wasting days in hospital really helps nobody, especially those that are in their final moments.
Thank you, Ms Grant. I'm going to give Mr Doris a little more time to get the audio sorted out. I'm going to come to Miles Briggs, then Bob Doris, up to 4 minutes.
Thank you very much, Presiding Officer, and my mic is working, which is good. But can I start by paying tribute to Paul Sweeney for bringing forward this debate, and also to pay tribute to Marie Curie for the amazing work they do in all our communities to support people at the end of life, and the research partnership they've obviously developed really in collaboration with Loughborough University as well. Because we know the stark figures this is presented here in my own region in Lothian, it points towards 20% of working age people dying in fuel poverty. And this report and the statistics, these are statistics, but they're human beings, they're people dying, and we need to remember that when I think we throw these statistics around the chamber. And we can do something about it, and I think that's why I wanted to bring forward the Right to Palliative Care Bill, and a number of members have mentioned that. I launched my proposals back in March and the consultation, and received substantial feedback from many organisations, but very much the hospice sector in Scotland. Because the establishment of the National Care Service some 76 years ago, and the founding principles of that care service from cradle to grave, underpins the social fabric of our society. But as a number of members have mentioned, including Fergus Ewing highlighting, an unrecognised reality is often that palliative care and end-of-life care is predominantly provided by the charitable sector in Scotland, and rightly so in many cases in terms of the quality and wraparound care for family and friends which we want to see. But we don't have a legal right to palliative care. That currently doesn't exist. Under current contracts, GPs are obliged to support patients with generalist palliative care. However, far too many do not see this delivered and not having their needs met. GP resources, as we all know, are completely overstretched. And the integration of health and social care, which Parliament passed, hasn't corrected this and hasn't delivered, as we've heard, the change we all want to see. Marie Curie's Dying in the Margins research really does bring forward the financial hardship, though, which many people from the most deprived communities in our country are facing, especially people facing terminal illness. My proposed bill looks at establishing that legal right, not just around palliative care, but I think the conversations we can have around wraparound support, which is also needed. Now, there are debates progressing through Parliament currently around the National Care Service. The Human Rights Bill could have been an opportunity to also take forward some of these debates, and the Housing Bill, which is coming to Parliament, will as well. But we need to look towards, I think, a better opportunity to solve some of these problems, and to look towards solutions where government and business and industry can also be part of this. And I say business and industry. Later today I'll be meeting Alistair Allen, the Minister, alongside fuel poverty campaigner Carolyn Hunter this afternoon, in fact, to discuss the progress around the potential development, along with industry, of a social tariff. That's something the First Minister announced the Scottish Government are looking to take forward. That's something I would hope we could look towards UK-wide, and industry being part of making sure that can actually be progressed is something I think we all would welcome and want to see. I think it's beyond its time that we did see a social tariff developed, and could present that solution for many individuals in our country. Marie Curie have also put forward a number of positive suggestions in their briefing ahead of today's debate to look at how terminal people could be directly supported in relation to energy bills. This includes extending eligibility for the winter heating payment to terminally ill people, and the reinvestment in the Fuel Insecurity Fund as well. I think taken together as a package, both governments at UK and Scottish level can take forward, I think, opportunities for us to find these solutions which can turn this situation around. No one should be dying in fuel poverty. No one across this chamber has raised any question around that. How we make sure we can deliver workable solutions, early intervention being one of the key things. Many people are not aware of the support which is available, and many people do not seek it when they are at their lowest ebb and dying, and we need to make sure our systems, our welfare systems especially, can work to change that. And I'll conclude on that point. Thank you, Deputy Presiding Officer.
Thank you, Mr Briggs. Right, I now call Bob Doris to be followed by Richard Leonard. Mr Doris, around 4 minutes, please. Even with the headset off, Mr Doris, I'm afraid we can't hear you. We will try and rectify that, and I'm going to go to Richard Leonard around 4 minutes. We'll come back to you, Mr Doris.
Thank you very much, Deputy Presiding Officer, and can I thank Paul Sweeney for leading this debate. The figures produced, the human face of what this means, described by Marie Curie in this report, are startling. In Falkirk, 1 in 7 people die in poverty. In North Lanarkshire, it is 1 in 6, and they are not just dying in poverty, they are dying of poverty. There are other dimensions too. If you are black, Asian, from a minority ethnic background living in Scotland, you are twice as likely to die poor than if you are white. And while we learned yesterday that men living in Glasgow no longer have the lowest life expectancy in the UK, Scotland still has the lowest life expectancy of all the UK nations. And the gap between the life expectancy of the richest and the poorest is wide, and it gets wider every year. According to the National Records of Scotland, women living in the most deprived areas are, on average, expected to live 25 fewer years in good health than those in the least deprived areas. For men, it is 26 years. This is a public health issue. It is also a class issue. It is a political issue. So we are witnessing an immiseration of the poor and rising indebtedness. But it is not just grinding poverty, it is rampant inequality. Because spiralling wealth, affluence, greed have come together with this plague of impoverishment. Yes, I'll give way.
Finlay Carson, briefly.
Does the member also recognise the huge inequalities that exist in rural Scotland, where in Dumfries and Galloway there's no hospice? We've just seen the IGB decide to close our beds in cottage hospitals, which means that people needing care at the end of life are often got no choice but to stay in an acute hospital where the facilities are far from adequate.
Richard Leonard.
Yeah, I'm very happy to agree with the Conservative member on the importance of inequality in looking at all of these issues. Because we hear the voices of the rich and the wealthy in Parliament, whether it's the landlord or the landowner of financial capital and the banker of the corporation and the super-rich, but we hear far too rarely the voices of the disinherited, the dispossessed, those who are bearing the brunt of this immoral injustice. Because poverty is not solely a lack of wealth, it comes with a self-reinforcing lack of power. And we know that poverty, low pay, unemployment, poor housing, run-down public services invariably go together. That hopelessness and powerlessness breed a crisis of confidence, which leads to demoralisation, then to alienation, and then to acquiescence. As Steve Biko attested, the most potent weapon in the hands of the oppressor is the mind of the oppressed. If we want people to realise all of their potential, not to spend their entire lives, still less their dying days, imprisoned in poverty, if we want people to be freed from this, to be literate, passionate and fulfilled in all of their diversity, then it is clear that we need radical social change. And this change cannot be left to the market and the nostrums of neoliberal economics, which simply fuel inequality. We cannot leave it to short-term mitigations, ameliorations or palliatives. And to my own party, I say in all honesty, neither can we leave it to modest reform, to more efficient economic management or to the improved administration of the state. It was John Smith who said that the job of the Labour Party was to persuade millions of the strength of our vision, the relevance of our policies and the urgency of our demand for change. And that is the radical tradition which all of us who want to change the outcomes set out in this report must return to. A slow revolution, in Danny Dorling's words, a long revolution perhaps in the words of Raymond Williams, but a revolution nonetheless, because too many people are dying in poverty. Too many are living and dying in fear. So we must use all of the powers that we have, parliamentary and extra-parliamentary, to bring about change, because that is our job, to lift people's horizons out of the hardship of the present by putting forward a vision of the better life, the better death and the better society.
Thank you, Mr Leonard. And I now call Bob Doris again. Mr Doris, up to 4 minutes, please.
I very much hope you can hear me, Presiding Officer.
Third time lucky, Mr Doris. On you go.
Thank you. Thank you for your patience. As convener of the Scottish Parliament Cross-Party Group on Palliative Care, I welcome the opportunity to once more discuss the issues relating to tackling poverty for those with terminal conditions and approaching the end of life, their families and their carers. I therefore thank Paul Sweeney for securing this debate, which allows us to consider the thoughtful and quite rightly, frankly, fundamentally challenging Marie Curie report, Dying in Poverty in Scotland 2024. That challenge provides an imperative for the UK Labour Government and the SNP Scottish Government to work together. No one should be living in poverty, let alone as they approach end of life. Marie Curie's Dying in the Margins report set out the unvarnished reality of living with a terminal illness in poverty. We must all work together to do more. At the heart of the Marie Curie recommendations is the direct challenge to the UK Government. It seeks to use the UK benefit system to tackle that poverty at source by allowing those with less than 12 months to live of working age to access their state pension if they have sufficient NI contributions. If not, they say they should access pension credit. I'm inclined to support that call. I would welcome a meeting with Marie Curie to see how we can progress that and ask the UK Government to consider it. I am not suggesting it will be easy. There will be complexities and financial challenges presented, but we must try. A key recommendation for the Scottish Government is to consider whether to entrench palliative care as an explicit right in law. Mr Briggs, who we heard from, is consulting on a Members' Bill in relation to this. I wish that well. I have stated in this chamber that I support that explicit right. What I have also said is that we must not only entrench that right, but also ensure that it can be exercised in an effective, equitable and consistent way. That doesn't need to require legislation in itself, because self-evidently we have a palliative care system in Scotland already with some wonderful practice. However, it is also under pressure and needs expanding, and it needs innovation. Entrenching that right in law can drive some of that change. The Scottish Government is currently consulting on a new draft palliative care strategy. Getting that strategy and future strategies right is also key, as is how integrated joint boards and others fund, finance and commission services. That sits at the heart of any right being exercised. Yes, the sector needs more financial support, but our cross-party group has also heard that innovation and service redesign and a meaningful partnership with the third sector can improve service and save money. Now, the additional £4 million announced in Scotland's budget yesterday for hospices will help, as will the Scottish Government guarantee that future NHS Agenda for Change pay awards in Scotland will trigger commensurate uplifts to fund the required pay increases within hospices. This is something I've been calling for consistently for some time. It will make a real difference. What would also make a real difference would be lifting the £2.5 million bombshell that UK national insurance increases will inflict on the sector also. Finally, Presiding Officer, I am also attracted to the recommendations around extending Scottish child payments and winter heating payments to families or individuals where someone is terminally ill, perhaps within the last year of life, similar to the calls of the UK Government over pensions. Again, I would welcome meeting Marie Curie to discuss further. In closing, Presiding Officer, I would welcome meeting with the Minister to discuss not just those proposals along with Marie Curie, but also the ongoing challenges that hospices face. And I once again thank Paul Sweeney for bringing this debate to the Chamber here this afternoon.
Thank you, Mr Doris, and thanks for persevering. And I now call on Jenny Minto, Minister, around 7 minutes, please.
Thank you, Presiding Officer, and may I too extend my thanks to Paul Sweeney for bringing this incredibly important and relevant motion to Parliament. Like Paul Sweeney, the Dying in the Margins exhibition and research has remained with me too, and is something I reference very often in my role. I'd also like to put on record my heartfelt thanks to every single member of Marie Curie's staff across Scotland and every single volunteer for everything that they do day in and day out to support people who are terminally ill, their families and loved ones. There will be few, if any of us in this chamber today, whose lives have not been touched at some point and in some way by the issues which Marie Curie does such remarkable work to tackle. It is right that all of us acknowledge that work today, and I thank all members for their contributions today. Elena Whittam talked about the importance of talking about death and dying and its reality, and I agree wholeheartedly with that point. And it's something that I do as a constituency MSP whenever I get the opportunity. Liz Smith, as always, a very thoughtful and practical contribution, and I recognise a lot of the points that she raised. Carol Mochan, your description of poverty being an anchor is really resounding, and I thank you for doing that. So I will remind myself of that, because you're right, it is the people that are impacted, and it's the people we need to think about. And I can't disagree with any of the sentiments that you or your colleague Richard Leonard raised in his contribution to.
Through the Chair, Minister, please.
Pardon?
Through the Chair.
My apologies, Presiding Officer. As Miles Briggs said, raising awareness of this is so important. And I think, as Bob Doris talked about, there are actions in the Marie Curie report that talk about social tariff to protect people living with terminal illness from spiring energy bills, and also, secondly, to address recent real-term cuts and freezes in working age benefits. And I note the atmosphere in the Chamber and would very much like to work with people across the Chamber to have that discussion to see how we can influence the choices and decisions of the UK Government. The Scottish Government is assessing this report and we are looking at where we can make changes. And I think if I touch first on the social tariff mechanism, we have repeatedly called on the UK Government to introduce one. And we have been working with the current UK Government, and we have convened a working group chaired by my colleague, Dr Allen. And it's a group of energy suppliers and consumer organisations to establish how a social tariff can operate. And following a positive meeting with the UK Government, we will be sharing the outputs of this, so that is an example of what Bob Doris has talked about, and also Paul Sweeney has talked about as well, regarding governments having to work together. Yes, of course.
Paul Sweeney, briefly.
I thank the Minister for giving way. She's making a series of helpful suggestions which are welcome. I just wonder if she might consider looking at forthcoming legislation, perhaps the forthcoming housing bill, in discussion with her colleague, the Housing Minister, about ways in which maybe more obligations could be placed on landlords to make necessary adaptations for people who are facing a terminal illness, so that they are more likely to stay in their own home.
Minister.
for that intervention, and I'm sure Mr McClellan will be listening to this debate and will be taking heed of some of the points that have been raised. A number of people also raised the situation around ethnic minorities and actions to equitable health care. The Cabinet Secretary for Health and Social Care and Sport has called out racism as a major public health issue, and we're working closely with health boards across Scotland to improve access and experiences of healthcare, taking a proactive anti-racism approach. And I recognise the concerns that people have raised in the Chamber. With regards to specifically around fuel poverty, Warmer Homes Scotland has been allocated £65 million this financial year, its highest budget to date, and we're now increasing that by a further £20 million to support even more households. And also, in recognition of the pressure on household budgets, our winter heating payment was uprated by 10.1% winter 23-24 and a further 6.7% for winter 24-25. And of course, just last Thursday, Cabinet Secretary Shirley-Anne Somerville announced bringing forward regulations for next winter to introduce a universal pension age winter heating payment. And that will include, including those with a person of pension age who's terminally ill, get support with their heating costs, and that's not available elsewhere. Elena Whittam raised the Scottish Child Payment. However, it's not possible to pay Scottish Child Payment to families with dependent children under 16 on presentation of a BASRIS form, because that does not relate to entitlement to a qualifying reserved benefit. But the Scottish Child Payment is just one part of our radically different Scottish social security system, in which we fast-track disability assistance applications from terminally ill people, and where terminally ill people automatically receive the highest rates of disability assistance they are entitled to. And importantly, there are no time limits on the definition of terminal illness. This decision is made by clinicians. And of course, as Elena Whittam also raised, a minimum income guarantee does have the potential to deliver transformational change, reduce poverty and equality, and we're looking forward to receiving the final report from our minimum income guarantee expert group, likely to be early in the new year. As part of the record spending announced in yesterday's budget, we support the delivery of the highest standards of palliative care and are strongly committed to equitable access to it. That's why we've published our draft palliative care, as other members have noted, but draft palliative care strategy for consultation. That, I believe, closes on the 10th of January, certainly early in the new year. I think it's an absolutely important piece of work, and I really encourage everyone in this chamber and more widely to contribute to that, because, as Elena Whittam said, we need to ensure that we are thinking about the best deaths for people.
Minister's just winding up.
I was going to raise, I reflect absolutely on what Fergus Ewing has been saying about the fantastic work that Highland Hospice does. And I, as the Cabinet Secretary said earlier in the week, we need to ensure that that work, that partnership work between NHS Highland is really strengthened, and I think that's an important way to work. We also have important connections with the Scottish Ambulance Service, providing home support with Macmillan as well. And on Miles Briggs's potential members' bill, I'm meeting with Miles Briggs early in the new year, and also Marie Curie. And to Bob Doris's point, I'm very happy to meet with people in this chamber who've contributed to this debate, because I believe this is something that we have to approach from a very non-political perspective, and together to get the best results for the people of Scotland.
Thank you very much, Minister. That concludes the debate, and I suspend this meeting of Parliament until 2 p.m.